What if you woke up one morning and you were blind in one eye? Naturally, you'd probably freak out. But surprisingly, there are people that wake up and they're deaf in one ear and they're not surprised or worried at all, and they don't call their doctor. So today we're talking about unilateral hearing loss with audiologist Dr. Gnewikow. And I'd have to say, I would be pretty freaked out if I couldn't suddenly hear in one ear. What exactly is this?
We call it a sudden onset hearing loss. It's not terribly common, but most of the people listening to this are going to probably know somebody in their church or their family that has had it at one point in time. I know my wife's aunt has had it. You go to bed at night, everything is fine. You wake up the next morning, you might be a little dizzy. Sometimes that goes along with it, and suddenly you can't hear out of one ear. We call it a sudden onset hearing loss, and most of the time it is related to viruses. It's not anything you've done, and it's not anything that, unfortunately, there's much we can do about. If it happens, the first thing you want to do is contact an ear, nose, and throat physician. There are some medications they can use sometime to mitigate the problem a little, but you have to act very quickly. It's kind of like heart attacks and strokes. Don't let it go. I've seen people who had this to happen and they didn't do anything for months, and then it was too late to do anything. Sometimes a sudden onset hearing loss can recover. Sometimes it can recover completely, sometimes partially, and sometimes it doesn't recover at all. But the first thing you do is act on it medically as soon as possible.
So what if it's just your sinuses and you got a lot of gunk in there? How do you know it's not something like that versus something serious?
Well, if you see your ENT or your audiologist, they can tell you very quickly. It's probably a matter of 15 minutes we can tell you if it's coming from that or not.
So what exactly happens then in the ear that causes this?
I don't think we know exactly. Sometimes it can come from circulation issues, but most of the time it's a virus. It, for some reason, targets one ear. It seldom targets both, which is good news. And what you need to be concerned about is the consequences of this. You think if you got a hearing loss in one ear, it's kind of an inconvenience, but it's more than that. For you guys that are hunters and have lost hearing in one ear and you're sitting in the deer stand, you can't tell where the deer is anymore because you can't localize sound. If you're driving in your car and you have a passenger on the right side and it happens to be your right ear, you kind of got a problem because you're hearing everything out of the left ear next to the window. If you're in a noisy restaurant, it can be a significant issue because the way our brain works, we need both of our ears to be able to hear well in background noise, particularly when a person is on the bad side. All of those can be issues that can affect you. I think you need to take it seriously and realize that although you don't notice it in one-to-one conversation, it is really having an impact on other communicating situations. There are some things that can be done, nothing necessarily to make it perfect. If the person doesn't respond to medications, sometimes you can use what's called a cross hearing aid. It looks like a little hearing aid over the ear, but it's a transmitter, and so it transmits the sound from the deaf side to the good side. You can do that.
Wow.
Another thing that's very important is that you protect your good ear, because if you only got one good ear left, you need to be extremely careful about medicines, about exposure to loud noise, and you probably ought to check your hearing periodically to make sure your good ear is not going down. So yes, it presents a problem, but if something happens to your other ear, which is the ear that you're doing all your hearing with, then it really does present a much bigger problem. So sudden onset hearing losses can be really significant medical issues. They need to be dealt with expeditiously, and you need to monitor your good ear to make sure that your good ear doesn't go down. So take it seriously.
Very good point. And if you'd like to learn more about unilateral hearing loss, you can call the folks at Audiology Hearing Aid Associates. They have two area locations, one in Lynchburg on Langhorne Road, 434-528-4245. Also in Danville on Main Street. The number there, 434-799-6288. And also online at digitalhearingforyou.com.